Nowadays, teenagers are more exposed to birth control methods to prevent an unintended pregnancy. My persuasive speech will focus on how emergency pills influence in teenagers' behaviors. First, I would like to begin by describing what are contraceptive methods and how they work. According to CDC, or for Disease Control and Prevention, birth controls are very important in order to reduce the risk of unintended pregnancy. Effectiveness can be measured during the perfect use, that is, when the method is used correctly and consistently as directed, or during the typical use, which is how effective the method is during actual use. The best way to reduce the risk of unintended pregnancy is to use effective birth control correctly and consistently. There are two different types of birth control: reversibles and permanent. In the reversible methods are the intrauterine contraceptions, that are the copper T intrauterine device, and the levonorgestrel intrauterine system. The copper T intrauterine device is a small device that is shaped in the form of a T. It can stay in the uterus for up to 10 years, and the typical use failure rate is a 0.8%. The levonorgestrel intrauterine system is a small T-shaped device. It is placed inside the uterus and releases a small amount of progesterone each day. This prevents women from getting pregnant. It can be in the uterus for up to 5 years, and the typical use failure rate is a 0.2%. Other reversible methods of birth control are the hormonal. The implant is a single thin rod inserted under the skin of the woman's upper arm. It contains progesterone that is released in the body for over 3 years. The typical failure rate is a 0.05%. The injection is a shot of progestin every 3 months. The typical failure rate is 6%. Combined oral contraceptive pill is a pill that contains the hormones estrogen and progestin. The woman that is taking this pill have to take it at the same time each day. The typical use failure rate is 9%. The progestin only pill it only has the hormone progestin, and it is taken at the same time each day. The typical use failure is 9%. The patch, it is worn on the lower abdomen, buttocks, or upper body. It releases hormones, progestin, and estrogens into the bloodstream. Women using this method have to change the patch once a week, and also it is used for 3 weeks, but not on the week that the woman is supposed to have a menstrual period. The typical use rate is 9%. Hormonal vaginal contraception is a ring that releases the hormones progestin and estrogen. Women place this inside their vagina, and the women that are using these methods wear the ring for 3 weeks, but not on the week that the woman is supposed to have a menstrual period. After this week, a woman has to put a new ring again. The typical use failure rate is 9%. Emergency contraception is not a regular method of birth control. It is used after a sexual intercourse If no birth control was used, or if the birth control method failed, like a broken condom. Barrier methods are also a reversible method of birth control. The diaphragm or cervical cap are placed inside the vagina to cover the cervix to block sperm before sexual intercourse. Women insert them with a spermicide. These help them to block or kill sperm. The typical use failure is 12%. The male condom, it keeps the sperm from getting into a woman's body. It helps to prevent pregnancy and sexual transmitted diseases. The typical use failure rate is 18%. Also, we have female condoms that do the same as the male condoms. They help to keep sperm from getting into her own body. It can be inserted up to 8 hours before sexual intercourse, and the typical use failure rate is 21%. Condoms can be used only once. Spermicides are products that work by killing sperm. They are placed in the vagina no more than 1 hour before sexual intercourse. Women can use this in addition with others birth control methods. The typical use failure rate is 28%. The other types of birth controls is the permanent birth control methods. They are safe and highly effective. Female sterilization or tying up the fallopian tubes. Women have their fallopian tubes tied up so that sperm and eggs do not meet for fertilization. This method is effective immediately. Transcervical sterilization is a tiny device is placed into each fallopian tube to irritate the fallopian tubes and cause scar tissue to grow permanently. They plug the tubes, and it can take up to 3 months for the scar tissue to grow. So doctors recommend to take another birth control method while this scar tissue is growing. The male sterilization or vasectomy, it is done to keep men's sperm from getting to his penis. So when they ejaculate, they do not have any sperm, and it cannot fertilize the egg. By explaining how the birth controls are and how they work, now I want to focus on my next step: emergency contraceptions. They are used to help keep a woman from getting pregnant after a sexual intercourse, or if they did not use any birth control methods, or if a method failed. It should not be used as a regular birth control. There are two types of emergency contraceptions. Those are emergency contraception pills and intrauterine devices. Emergency contraceptive pills have higher doses of the same hormones found in regular birth control pills. There are two different types of these pills that are approved by the FDA. One is called Plan B One Step, and the other one is called Next Choice. Plan B One Step only has progestin hormone in higher levels. It is one pill method. So this emergency contraception is available over the counter for people ages 15 or older. It must be taken within 72 hours of unprotected sex. Next choice is also a progestin-only birth control, but also has higher levels of the hormone. It is a two-pill method. The first pill should be taken as soon as possible within the 72 hours of unprotected sex. The second pill should be taken 12 hours after the first pill. It is as well available over the counter for women. The other emergency contraception is a intrauterine devices. They are small T shapes like the copper T, and they are placed into the uterus by a doctor within 5 days after sexual intercourse. They work by keeping the sperm from getting in from joining the egg or keeping a fertilized egg from attaching the uterus. Doctor can recommend the device can remove the device by the next period. So they wait one period to menstrual period to remove this. Also, but if the woman want, they can leave the device in place for up to 10 years to be used as a birth control. Emergency contraception can have some side effects. Women might feel sick and they might throw up after taking an emergency contraception pill. Also, women can experience headaches, dizziness, lower stomach cramps, irregular bleeding, breast tenderness, and fatigue. Intrauterine devices can have risk of pelvic infection or harming the uterus. So finally, I would like to say that the effects on teenagers' behaviors by using this pill. So the U.S. Food and Drug Administration approved on April 30th that women of age 15 or older can buy any emergency contraception pill without prescription. Teva Women's Health Inc., which is the brand that makes Plan B, will make variations to the product's labels that will state that only women that are older, 15 or older, can buy this product. As well, Teva will make the pill available in retail stores, which has a on-site pharmacy. People can find this in the pill in the family planning or female health aisles. FAD articles say that researchers has shown that access to emergency contraception products have the potential to further decrease the rate of unintended pregnancy in the United States. As well, they stated that women aged 15 and older understood how Plan B once they work, how to use it properly, and that it does not prevent the transmissions of a sexual transmitted disease. So first, I would like to say that women of age 15 are still minors, and the responsibility of these minors are under their parents. I believe that this bill will increase pregnancy rates in the United States because now there is no fear to get pregnant if a woman have unprotected sex. Also, they have less chance to get pregnant with this bill, so they have the green light to be open to anyone. Parents do not have now the control of their children's sex life, and because of this, they cannot be fully aware of what is happening into their children's life. As Teva stated in their article, emergency contraception pills are available in the family planning aisle. I think that this is a good idea, but for not for I think this is a good idea, but not for now that this bill is available to minors. I see that is quite of an error, because women of 15 years old are not planning to have a family, and they should not be planning one. They only they only need to focus in their studies and do well to be successful. Teenagers now have the green light, I just said it before, to be confident about having unprotected sex, and this can lead to sexually transmitted diseases and active sexual life. I believe the morning after pill is a great second option for mature women in cases they have an accident with the birth control method, or if their birth control method didn't work. But it is not a good idea to have it available for teenagers that have high levels of hormones and do not know how to take care of themselves and their sex life. Now there is nothing. There is nothing we can do to stop this pill from being available to teenagers. But I would like to encourage teenagers to be more open with their parents and ask for their advice before they do anything. Like, as well, I would like to say to the parents to understand their kids, and instead of judging them, help them to have a healthy sex life and making the right choices.